questions and answers about your developmental disability services. Presented by Anne LeClaire and Andrew Whalen at We Belong Here, Rhode Island's 2024 Statewide Self-Advocacy Conference.
So we are in the session of questions and answers about your DD services.
Yep. This is presented at the Advocates in Action Conference, May 9th, 2024. And it's presented by me, Andrew Whalen, and
Me, Anne LeClaire.
thank you. Right. So the first question on our list is, why is there a staff shortage?
So there are a lot of reasons nationally why there's a shortage of staff. Some of it is low pay in this industry nationally. There's lower pay than other fields. Rhode Island, however, passed a minimum of $20 an hour that started this fiscal year, so last July. So we're now one of the highest paid rates for DSPs in the country. So hopefully that has improved the ability for people to find staff. Some is a lack of benefits. So not every DSP has access to a full benefits package, including paid vacation. The picture there shows paid vacation, health insurance, bonuses, or pay raises. So that can drive some staff out of the field. A few opportunities for growth. So there aren't a lot of opportunities for promotions within the field, though we're working on different pathways and different certifications. So people might have more options. If they gain more skills, they can get more pay. Too many or too few hours, depending where people work or who they're connected with. Some people might have a lot of overtime that they don't want, or might not be able to get the hours. So within our system, we're also trying to share opportunities so people who want more hours can find them. And one that impacts all types of businesses are low unemployment rates. Because when the low unemployment rate means there's not a lot of people who don't have jobs. So the people who are looking for jobs, there's more jobs posted than there are people looking to fill them. So that gives the people who are looking for jobs a lot of different options. And for some people who might have tried this field, they might not give it a try because they have other options that they might be more familiar with. So we're trying to let people know what the job entails. The Statewide Workforce Initiative is working on that, called Realistic Job Previews, so people can understand what the job is. So we're trying to address a lot of these issues, but the fact is, with very low unemployment, it's tough competition to attract workers to this field.
Question number 2. How do I find my social caseworker?
So there are 3 ways I can think of offhand. One is on letters from the division. We've started adding the social caseworker and their contact information. See it, you probably can't read it because it's very small, but this box here, we've highlighted it. Whoops, sorry. Highlighted it here. So on some of the letters from the division, we've started putting it on them. You can call the division's main number and at 462-3421 and ask who your caseworker is. And they'll transfer you and should give you the direct line phone number. You also want that. Or if you get provider services, you can ask your provider. They'll have in their system, they can look it up and see who your social caseworker is. Feel free to ask questions as we go.
Question number 3. What is the grievance process?
This question came in and we weren't entirely sure what kind of grievance someone might have. So we're going to cover a few different ones. The first are what we call administrative reviews and appeals. So that's when the division makes a decision that you don't like or don't agree with, I should say. It could be the CIS, when you get back the CIS tier, the score for the CIS, that the CIS indicates your level of need. If you think something was missing in there, or for people who are just applying, if someone is denied eligibility and they think that was not the correct decision, sometimes we don't have all the information. So the first step would be an administrative review, which is just telling the division, I don't think this is the right outcome. Then representatives will meet with you and go over everything that we had to make the decision. And people can present more information if they have more information that wasn't shared before. And we'll go through it again and see if the decision changes. If the decision doesn't change or still doesn't seem to be right, then you can file a formal appeal, which is handled by the Executive Office of Health and Human Services. So they'll take it through another formal process and review everything again. So sometimes the administrative review has a finding, but people might come back with even more information in the appeal, and the appeal will have a different decision. So that's when it's related to those kind of decisions. When it's just a complaint about a service or a provider, in those cases, people can call their social caseworker. We don't have a very formal process yet, but we've been talking about how we capture this information more formally. And if we can put something maybe online that people can fill out rather than calling, if people would prefer to do that. So we will, when it's just a complaint and not something like an administrative review or appeal, we want to make that an easier and more easy to find how to do it process. But right now, people would call their social caseworker and talk with them about the complaint. If a complaint is serious enough, it may need to be reported to quality assurance. So those kind of cases would be if someone is doing something with your money that you don't think they should be doing, and you haven't given them permission to do that with your money. That would need to go to what is called our quality assurance unit, which is the division's unit that investigates these kind of serious complaints. They investigate questions of abuse or mistreatment or financial exploitation. So if a complaint rises to that level, we'll do a full investigation of it. So any questions or any other interpretations of grievance that we missed that anyone can think of?
Question 4. What's going on with plan writers? And I think a companion question to that is, will my old plan writer still be able to help me?
So there's a lot of rumors and concern going on about some of the changes at the division and the state that's happening, and especially around the plan writers, because some people, especially people who self-direct, have been working with their plan writers sometimes for many years. And there are some changes. So the quick answer to will my old plan writer still be able to help me is the ever so helpful, it depends thing. So we have two things happening at the same time right now that will affect that. One is called conflict-free case management. So across all state departments that have Medicaid services, Medicaid, the national federal Medicaid, has determined that something called conflict-free case management needs to happen, which means that the people who write the plans can't be affiliated with the people who are providing services. So it has to be separated. So that's going to be starting up probably in June. We'll start making referrals to some of the new providers who are going to be doing the case management. but it will be very few to start because they need to gear up. They will be writing the plans and monitoring the plans, doing all of the pre-planning, making sure people are getting the services they want, whether the services are within the DD system or outside of the DD system. So they'll be looking at everything available to somebody. Because it's going to take time for conflict-free case management to get fully up and running for everybody, we'll have something called independent facilitators, which for people who work at providers, those will be state workers. There'll be a new member of someone's team. So people will still keep their social caseworker that they have, but they'll add this independent facilitator who will work for the state to their team. And that person will focus just on the plan, on making sure the plan's written and addresses everything someone wants, and also doing some monitoring of the plan to make sure people are actually getting the services in their plan. And the caseworker will still be there to handle other issues not related to the plan. For people who self-direct, the independent plan writers were approached and offered kind of contract positions through the Sherlock Center to serve that role. So it depends if your plan writer has decided to become one of the independent facilitators or not. So if they are, you can keep them. If they aren't, then probably you'll have to change to somebody else. Some of them might, the current independent plan writers might also apply to work for a conflict-free case management agency. So it depends whether they become affiliated with one of these areas, either the new case management or the independent facilitators. And you'll be hearing more about independent facilitators in the next few weeks. More information will be coming out about them. Any questions or concerns or follow-up on the plan writers?
All right, question number 6 on our list. Next, what's up with the CIS?
So there's a lot up with the CIS. It's been going on for a while now. So the biggest thing is that the company that owns the CIS, it's called the American Association for Intellectual and Developmental Disabilities, or AAIDD. They came out with a new version of the CIS called the second edition. So it had been over 10 years since the first edition, so they just went through it, made sure all the questions they were asking were still questions that needed to be asked and are being asked in the right way. And they did add a few questions. So that means that the whole way they score needed to be evaluated. So we're still in the evaluation phase where we needed to do a few hundred CISs with the new CIS, and in order to have enough to see how their scoring matched our usage of those scores. Because we don't use the raw score, we take the raw score and we turn it into the tiers that we have. So we needed to make sure that that was still valid, or if we need to change how we look at level of need because the CIS changed. So we're still in that process. At the same time, we're doing all of that because the CIS changed. The court, under the consent decree, looked at how we were looking at people's level of need and thought we needed a little bit more. So we have a new 3-step process to look at someone's level of need. The first is still the CIS, but now we've added the additional needs and support questionnaire and then a follow-up. So the additional needs and support questionnaire is to find out in more depth things that the CIS may not be capturing. So some of it could be legal involvement or caregiver, if there's something going on with a caregiver that we need to know about. So right now, the additional needs and support questionnaire is still being run a lot like the S109 process. So we need to turn it more into a score, like the SIS has in some ways. So we want to use both the SIS and the additional needs and support questionnaire score to have a better picture of someone's level of need. And once we have those new scores, we'll use them to develop a new individual funding formula. So instead of the packages that we had, because we have a new score from the SIS and then this additional information that we're getting from the questionnaire, we'll have a new formula that might be much more individualized. So two people who live in the same living arrangement may have different funding than they would have under the tier packages because they have different scores between the SIS and the additional needs questionnaire. Any other questions on the SIS, or did I confuse everybody? So during this time where we're testing the SIS scores, we're still assigning a tier based on the SIS score. When we get the final results of the evaluation of whether our scoring matches the new SIS, some people might see their tier change. We don't know that it will or how many will. We think it's going to be pretty close, but people are getting letters now that say they're interim SIS. Interim means in the meantime, so while the testing is going on. So there is a chance some people's tiers may change, but we will give a lot of notice and talk with people around that change if it happens. Okay, question 7.
Yes, indeed. Question 7. What is the new budget?
So I don't know if people have seen this yet. Some of the materials we put out that, as I said, we used to have those tier packages that had all of the line items. So you had this much transportation. No matter who you were, what you needed, you had this much transportation, this much community-based supports, this much of this, and this. Now the budgets show you have this much flexible budget and this much fixed budget. Or you may not have a fixed budget, depending on your circumstances. The flexible budget does include most services, and it just means this is the funding you have available to you to decide how to use it in support of your goals. So if you don't need transportation, like Jane, if you don't need any transportation because you have someone who drives you everywhere, and so you need a lot of transportation, you have the option of, instead of getting the same amount for transportation, you have the option to, Jane, you can use it for something else, and so you can put a lot more money into it because that's what you need and what supports your plan. So that's the flexibility part. The fixed part of the budget are the costs that you can't control and you have to pay. So if someone is living in shared living or a group home, that shared living provider or the group home provider have to be paid every day. You can't take that money and use it for something else. So there's no flexibility there. They have to be paid. If you self-direct, your fiscal intermediary has to be paid. So those are the fixed costs. So if you have those services, you have to pay them. So they're outside of the flexible budget. Then we also have an add-on budget. So when you get your funding level, this money's not in there. The money that you get when you have a funding level, or you formulate the tier package total amount, is the flexible budget and the fixed budget. If you need certain services like employment, we're going to give you more funding for that specific service. So people don't have to choose between getting community-based supports or going to work anymore. Previously, they had to trade that off. So some other new services like peer supports and family-to-family supports will fall under this add-on budget as well. So that's a big change. If people have employment still in their regular funding, you're going to want to talk to your plan writer or provider or fiscal intermediary about separating that out into the add-on budget so you can have your flexible budget for other things. I think some people are waiting for their next plan to do that. Any questions on the new budgets? Because it's a big change with how we're approaching the budgets. So it does mean people need to have more of a conversation when they're doing their plan, because the plan comes first. The plan always comes first. That's what you want or need for the coming year. But then you have to talk about how do you want to fund each of those things. So if you have two goals and one is a bigger priority for you than another one, you might want to put more money to that than the second goal. So you have to decide how much you want for each one of your goals and how that affects services. Where before you just had to say what was in your plan and then we told you what your budget was. Andrew, have you done a new budget yet?
No,
Well, you self-direct, so you kind of always had that flexibility to do what you wanted with your
yeah, but
funding.
I haven't really even had a conversation with my plan writer yet, and I'm still waiting for her to get in touch to set this up. But I think my schedule was a bit chaotic, especially when it comes to getting my sisters in the same room. One of them just started a new job in Princeton, New Jersey, of all places. I think we'll be able to arrange a Zoom, but it's going
Yeah,
to
so you
take
haven't
some
got-
time to figure it out.
Yeah, I think that's what's happened with a lot of people. So not a lot of people, or not as many as we expected, I should say, are taking advantage of the add-on budget yet for employment.
Mm.
But I do think that if people are self-directed, they probably will see less of a change other than the add-on. Because I think people who self-directed were always used to having more of a conversation around how to use their funding than people who are provider-based. But now even people who are at providers will have more of that flexibility to decide what they want to do.
Okay, are there any other questions on these topics that we didn't cover in our presentation?
We still have half an hour. We went through. Let's ask. We need to ask for more questions if we do this again.
Yeah, definitely.
And we're up against some tough competition for this session.
Yeah, apparently there are only 3 other people here besides you and me, so I guess we were.
I think
It's a
this
great-
is a session though people might come back to. They figure they can watch it later.
Great
Yeah.
presentation, though.
It
was
really
really good.
is, and having this recorded is going to be super helpful.
Yeah,
But podcasts or your rights, and I think the rights one is fun. I saw some of it before that they did it. Yeah, we're up against tough competition. We always are.
Mm.
But any other questions you think anyone you've heard in other areas that maybe we should just address for the recording so people hear the answers?
I think there was only one question that I had, and it was related to plan writers, and I think I've asked this question in a couple of different forums now. And that's, does it matter whether your plan writer can stay your plan writer if they don't live in Rhode Island?
Good question. No, it matters who they're affiliated with. So they could live in Massachusetts or Connecticut, but if they are the going to be some of the independent facilitators working with Sherlock, or if they get hired by the state, we have state workers who live in other states. So it doesn't matter where they live. It matters where they work. Actually.
Thank you.
Well, thank you, everybody.
Thank
Yes,
you.
indeed. Thank you.
Thanks for joining us at today's session. Visit our conference website to download the slides for this presentation and view other workshop recordings at www.advocatesinAction.org/2024SACONF. Produced by Advocates in Action Rhode Island, 2024. Remember, nothing about us without us.